Hello, I'm Samit Biswas, founder and CEO of Health Tech Services Group. We call it HTSG. Our core focus in the provision of essentials healthcare services, particularly catering to the elderly and the individual with disabilities, delivered directly to their doorstep, ultimately removing the need for visits a general practitioners or a clinic. Additionally, we extend secure transportation solution, ensuring a safe passage from the medical facilities, swiftly returning for the discharged patients back to their home. This business model has a potential to yield substantial tax savings for the taxpayer money. We all know how NHS are struggling in terms of patients waiting, and that is where we bring value to the system. So within the NHS and other healthcare providers worldwide, we have identified three essential gaps which have become very expensive for the healthcare organizations to manage simply due to the resources shortage and delay in monitoring. First is the timely monitoring of chronic condition of patients or lack of GP appointments, which we all know, as per the recent data published by NHS, 8 million patients are waiting for their appointments. So we are also operating the shared vision of planned growth. Our initial foray involved establishment and implementation of a health tech services group with 7 different locations all across the UK, 2 in Wales, Scotland and Northern Ireland. That will help us to offer the service delivery to the end user or to our clients within 2 hours timeline. Interest has been shown different parts of US like East Coast and Southern California to implement this clinic at home model to offer this wider range of services to the people with disabilities and other elderly care people. Secondly, we all know the prolonged occupancy in the beds and discharge happens in the NHS. As per the last published figure, NHS lost almost £1.2 billion in 2022 alone to hold these patients back after discharge. And thirdly, the most important thing is missing appointments. NHS costs £30 per patient if someone is not able to attend the appointments. And in total last year, they spent almost 216 million. So we are poised to introduce 3 fundamental primary healthcare services tailored to cater our elderly and vulnerable population. 1, a personalized end-to-end transportation services bolstered with cutting-edge digital safeguarding technology, courtesy to our transportation service CareSafe Mobility. Second is a personalized GP care services at the client doorstep, coupled with diagnostics and made as possible through a clinic at homes initiative. Third, a remote medical monitoring system facilitated by our WatcherX smartwatch that help us to monitor any individual 24/7 remotely. So I have managed to build a team of like-minded people who share the same vision and create a global healthcare service delivery model at the doorstep. Our initial foray involves the establishment and implementation of HTS group service in 2 locations and expand the same service level in different parts of the UK, like 2 in Wales, 2 in Scotland and 2 in Ireland and Northern Ireland. This will help us to offer our deliverables within 2 hours to the end user, like our patients. Interest has been shown in the US and 2 other different markets in Eastern Coast as well as Southern California to launch these clinic at home models. And our primary care targets is to provide all the stakeholders a feed of live streaming of the whole journey. Because as we all know, when patients taking in a transport from one location to other location, there is a lapse of safeguarding. That is where our technology will help to see by all stakeholders that whole transportation live. And we are building a technology that will help us facial recognition and predictive analysis on AI platform to understand the chances of that person falling sick while transportation, so that we can safeguard that person or that patient. And that is the reason we say we are in a business of digital safeguarding and reassuring the whole clients. We have a trained team of nurses who can go to the client's home and offer a home-based customized primary healthcare services. Thank you very much for listening us.